Hi, I'm Calamity Jones, and this TED Talk is on Obamacare.
And I'm Cassidy Jones.
Obamacare, a large percentage of the public is completely misinformed about what the law actually entails. Many of these misconceptions have been intentionally cultivated by political pundits from both the left and the right. And predictably, people have latched onto the distortions which most closely fit into their worldview. Let's remove all the party politics and set the record straight. One of the most prevalent misconceptions about Obamacare is that it's socialized medicine. Some view this as a good thing, others view it as a bad thing, but the debate is irrelevant because it simply isn't true. Socialized medicine, like what they have in France, provides all citizens with healthcare services regardless of their income bracket and pays for it through taxes. That's not what Obamacare does at all. Obamacare is designed to force every single person in the U.S. to acquire health insurance from private companies regardless of where you get it. If your employer doesn't provide it, then you must purchase it on your own. If you don't, you'll be penalized, and that penalty will be collected by the IRS. This is referred to as the individual mandate.
Obamacare is not an effective form of health care because it does not serve its intended purpose. Obamacare is supposed to supply the less fortunate Americans with health benefits, but it has become too expensive for some Americans, and Obamacare does not cover all aspects of a health insurance policy. Health care is something that should be available to all people, whether they are wealthy or poor.
New parts of Obamacare are making healthcare too expensive for the lower class of America.
If we make healthcare unavailable to the general public, then both of our community and government will suffer. Let's discuss the pros and cons of Obamacare.
Here is the pro. Tens of millions of uninsured will get access to affordable, high-quality health insurance through Medicaid expansion, employers, and the health insurance marketplace.
And let's discuss the cons. Employer mandate. Most companies will have to provide and pay for expensive government-determined health insurance for their employees or face federal fines. Religious organizations will be required to provide free sterilizations, contraceptives, and abortion-inducing drugs to their employees, even if it violates their religious beliefs. The law contains at least 20 new taxes totaling $500 billion that will hit medical innovators, health insurance, and even the sale of your home. Also, Medicare payment cuts and higher health care costs, and many more.
While Obamacare does have its flaws, its intentions were good.
As you can see by the graph, Obamacare was expected to decrease the number of uninsured citizens. However, it has failed.
If you like your health care, can you really keep it? President Obama promised reform would not affect existing coverage. While it remains uncertain exactly how many Americans will lose employer-sponsored plans under Obamacare, studies show it will be millions.
As you can see by the visual, millions of citizens are losing their employer's health insurance and are ending up completely uninsured.
Another opinion is, Obamacare could also be described as unneeded. Why should we give our money to people who are physically and mentally capable of getting a job? So many Americans are living off Obamacare and other programs when they could easily go get a job, and they're living off our tax dollars.
In my opinion, this new health care act hits middle class the hardest.
From my experience, I've seen a fully capable mother of 8 children living off our parents' taxes.
Did we make the choice to conceive all those children? Then why are we paying to raise thousands of them on Obamacare?
But that's none of our business.
As depicted in the graph, since Obama has become president, the overall unemployment rate has increased dramatically over the length of just a few years. As you can see, millions of people are receiving large amounts of tax dollars every year, and by 2016, the amounts will double in size.
Roughly 109 million, 34.5% of capable Americans are living off the government every year. Are we really getting this affordable, high-quality health care that Obama has promised us? And this is the Jones twins signing off.
Stay classy, JHS.